Well, reports are that NHS waiting lists have started rising again. And all this week, I'm giving you the chance to call the doctor. I'm going to be joined by a host of medical experts as I open the VHS, the Vanessa Health Service. If you can't get a medical appointment, whatever your condition is, we'd love to hear from you. And we're kicking off with dental dilemmas with Dr. Hannah Kinsella, 0207 862 2222. Good to have you here. Why is NHS dentistry in such a terrible state?
Do you know what? I think it's so frustrating. I think it's frustrating for patients, but it's also frustrating for dentists because they just can't fulfil the need. There's just not enough funded appointments available. NHS contracts are limited, and people are really struggling. And I think the pandemic didn't help things. You know, after the COVID, a lot of practices are really struggling to keep up. You know, from all of the delays that the pandemic caused.
And that was partly to do with everything that dentists had to do to put these safety measures in place.
That's right.
Expensive, incredibly time-consuming, all that sort of thing.
That's right, that's right. And we were actually deemed non-essential workers for 3 months, which is crazy.
Yeah.
So there were patients, you know, in pain, halfway through treatments, and they just couldn't get back in to see the dentist. So, yeah, I think, you know, it's really hard for
If
people.
you were in charge of the whole situation, what would you do to improve it?
I think there's a problem with a lot of dentists now wanting to move into the private sector, and there's a whole host of reasons for that. I think, you know, if dentists are sort of, you know, paid for the treatment that they're doing, and they're then less likely to move across the private sector.
I mean, it's fair to say that you yourself have moved across.
That's right.
And that was because it just wasn't financially worth your while.
Yeah, and you just can't provide the quality of treatment that you want to. You don't have the time to spend with the patients that you'd like to. And I think the way that it works with the NHS is that you're not paid per patient, you're paid via units of dental activity. And whether you're doing 1 filling or 10 fillings, the dentist is getting paid the same. And so the dentists are just not as incentivised, and you're getting a lot of people moving across to the private sector, unfortunately.
Well, let's talk to Claire Simmons. I mean, we had a look at her teeth before. Claire, your NHS dentist went private. As a result, it was very hard for you to find appointments. And somehow or other, you've lost 7 teeth, you poor thing. What happened?
They just started crumbling and snapping. I'd wake up in the morning with a bit of teeth on my tongue.
Oh.
And it's been steadily happening for the last 10 to 12 months.
God, I'm really sorry. That looks so painful and difficult. Have you been able to find a dentist now?
No, I've got no NHS dentists in Norfolk at all that are taking patients.
It's terrible, isn't it? So, Hannah, is there anything you can say to Claire? This is awful.
Yeah, I mean, that looks awful, Claire. I'm so sorry that you've had to go through that. I think the main thing really is trying to prevent this from happening further. Good oral hygiene, really focusing in on, you know, flossing and brushing is what I would recommend.
I was doing all that.
Yeah, and it is difficult, really, isn't it? I think, you know, when you get into that point and you're losing teeth, trying to prevent it from going any further, it's just a case of trying to, you know, up your oral hygiene as much as you possibly can.
And can I just ask something? If Claire were in complete despair and she just presented at A&E saying, look, I'm a major dental emergency. Look, my teeth are crumbling in my mouth. I wake up in the morning, there's a bit of tooth on my tongue. Can A&E departments do anything or not?
There are A&E services within dental hospitals, so that's definitely an option. And I also know that if you call the NHS helpline, then they can sort of navigate you to the closest emergency care sectors. But it is difficult. I mean, there are some areas where there just isn't any access.
Claire, I'm really sorry. Listen, we're going to crack on because we've got so many calls on this. Jackie's on the line in Buckinghamshire. Jackie, what's going on with you and your teeth, my love?
Oh, hi. Yes, I'm 53 and I still class myself as quite young.
You are,
and I had my teeth removed a year ago at the top, and I'm waiting. I waited 2 years for an NHS dentist in my area, and I luckily got one, a very good local dentist.
Great.
And I want a denture that screws in top and bottom. I haven't been out socially in about a year.
Yeah.
It's really affected my life. And I don't want to go abroad because I've read horror stories, so I'd like to stay in the UK. What would be the cheapest way to have it done? I am an NHS patient, and
Okay, let's ask Hannah.
I'd like to take. Yes, thank you
What
so
can
much.
Jackie do, Hannah?
Yeah, I mean, it sounds to me, Jackie, that what you're looking for is an implant retained denture, and yeah, unfortunately, waiting lists are so long for these. I think in the meantime, a traditional denture, if you get it made well, there are different adhesives that you can buy over the counter that you can use to try and help with that. But yeah, I mean, implant retained dentures, that there is unfortunately very long waiting lists.
What kind of price are they?
They can vary. I mean, they vary from, anywhere from £3,000 upwards.
Oh, blimey.
That's if you have it done privately. But obviously, if you are looking for them on the NHS, then again, my advice would be to go to local dental hospital and get onto that waiting list as soon as possible.
Absolutely, Jackie. Good luck with that. I'm so sorry. Let's go to Pauline on the Isle of Wight. Oh, no, she had a wisdom tooth removed and it all went terribly wrong. What happened, Pauline?
I basically was given a choice of having the general anaesthetic or having local anaesthetic for one wisdom tooth.
Yeah.
So I went for general anaesthetic, and basically they took all 4 of them out, but they really bruised my face really badly and chipped all the back of my teeth. So consequently, I had to have loads of fillings put in my teeth. Now those fillings have all come out, so all my teeth, all my molars basically have all deteriorated really badly.
Yikes.
Oh.
I mean,
And I've been trying to get help, and there's just nowhere to turn to at the moment, really.
Hannah, that sounds pretty terrible.
Yeah,
Can she
yeah,
sue?
that does. That does sound terrible.
Yeah.
Yeah. I mean, again, one of the big things, I guess, when fillings fall out of the teeth or when you've got cracked teeth, your teeth are more exposed, so they're much more likely to decay. So again, I think limiting sugary snacks, sugary drinks in between meals, a big culprit, sugars in teas and coffees, that kind of thing can also deteriorate the teeth. So trying to limit those and, improve the oral hygiene as much as possible is all you can really do. Again, there are over-the-counter things that you can purchase, temporary filling solutions. But again, it's something that a dentist does need to have a look at.
Yeah, I'm so sorry, Pauline. It sounds absolutely dreadful, and that wasn't her fault at all, was it? She was only meant to get one wisdom tooth removed. Poor thing. Let's go to Keith in Swansea. Keith, you're worried about your teeth as well.
Yeah, good morning. How are you doing today?
Doing fine, thank you, and I hope you are, but what's the story with your teeth, sir?
Well, back in 2000, I was exposed to some serious norm radiation, and when I went to see my dentist, I'm talking about 2 years ago, she told me, she said, radiation can accelerate any decay to your teeth. And I went, oh my goodness. And I, told her. And now, in the last few days, all my front teeth have just collapsed. And to try to find an NHS dentist at the age of 74 is a nightmare. An absolute nightmare.
So you're wondering whether there are ways, Keith, of strengthening your teeth. So I'm imagining this is after radiotherapy or something like that.
Right, that's right.
And you hear that's a routine side effect, is it?
It can accelerate decay in the mouth because it dries the mouth as well. So your saliva protects your teeth against cavities and protects your teeth against decay. So once that saliva rate reduces, then you are much more higher risk of developing decay.
OK, is there anything Keith can do that's so horrible for him?
Yeah, I think using a good quality high fluoride toothpaste, I mean, we recommend 1,450 parts per million of fluoride in a toothpaste. Fluoride obviously is proven to strengthen the enamel, and there are fluoride mouthwashes that you can use as well to help strengthen the teeth. But
what about anything else, for example, like any vitamins or any minerals that you can take maybe to... I'm just thinking of preventative rather than...
Shoring your teeth up a bit.
Yes, exactly. Beforehand.
Yeah, there are supplements. There are supplements that you can take as well, calcium, vitamin D, multivitamins, having a varied diet as well.
And also, I want to ask you, Hannah, while you're here, Keith, I wish you well with that. I'm so sorry, but ask you, because I asked you before the show, is there anything you can really say on the television that can make a difference? And you said yes. I can talk about pain management.
That's right.
So if anybody is watching us now and their teeth are killing them. I mean, toothache's one of the worst pains known to man.
No
It's
wonder
just
babies howl.
shocking, isn't it? Shocking.
That's right.
What can they do? What can you suggest?
I think with toothache, it's an awful pain, and I think managing it with things like ibuprofen, paracetamol, warm salty mouthwashes also help. Warm compresses help. So if you've got a hot water bottle or an empty bottle of water, if you fill it with hot water, wrap it in a towel, put it over the affected area, that can also help alleviate the symptoms of toothache. But if it's something that's persistent, definitely need to see a dentist.
Okay, appreciate that. But all these people who can't get anywhere near a dentist, it's a dreadful situation, isn't it? What's meant to be one of the most civilised countries in the universe, and people can't see a dentist.